I'm Matt Willis, Public Health Officer with the Marin County COVID-19 update. On Monday, the local mask mandate for Marin County will be lifted, but masks will remain an important tool in our pandemic response. I'd like to explain why we think we're ready and step back to describe how this decision ties to our approach to mandates for pandemic policies. The mandate was put in place on August 2nd as part of a Bay Area-wide public health response to the surge in cases related to the Delta variant. On October 7th, the same Bay Area counties established common criteria for lifting county-level mask mandates, knowing we'd reach those benchmarks at different times based on local numbers. Today, Marin County met the three criteria established. Vaccination rates are above 80% for all residents. Hospitalizations have declined. In fact, today there are only 2 people with COVID-19 in Marin hospitals and none in the ICU, which is a 4-month low. And it's been 21 consecutive days since Marin County moved to the CDC's moderate community transmission rate for COVID-19. I have no doubt that this is the time to take this step. Tying the policy to clear criteria designed with fellow regional health officers ensures the conditions are in place to peel back restrictions carefully. I also see this as an important step in the relationship between public health and the community at a high level as we move into the next stage of our pandemic response and recovery. As we tiptoe back towards normalcy together, I want to get out of the business of issuing mandates and orders, unless it's an urgent threat to our lives or our healthcare system. Throughout this pandemic, public health, mostly at the state and county level, has been applying mandates or orders to influence behaviors and secure the common good, rooted in the available science. We needed to take that kind of action for rapid community-wide change when the pandemic was threatening everyone. There's a clear correlation between places with strong public health policies and better pandemic control at the local, national, and international perspective. But a mandate invoking law is an urgent measure and not taken lightly. Lifting the mandate now acknowledges that there's a threshold for using law versus issuing recommendations. The criteria we established at the county level say the risk is low enough to make that shift. In other communities, the risk remains a bit higher, where the criteria are not yet met and where the mask mandate remains important. High vaccination rates and understanding the value of face covering has made it possible to begin to lift restrictions. The mandate has helped get us through the 4th wave. If I have any concerns about lifting the mask order, it's that people will interpret this as a sign we're no longer needing to cover our faces, or we're done with masks. That would be a serious mistake. Face covering has been and will remain a critical tool for preventing spread of the virus. To be more secure coming into the winter months, we need to continue to use face covering, especially in places of higher risk, and gain even higher vaccination rates. Remember, masks work both ways. They protect you and the people around you, including, importantly, those who are too young and not yet eligible to be vaccinated. Remember, this just puts us back to where we were in July and doesn't impact the face covering requirements issued by the state of California, including those for all unvaccinated individuals in indoor public settings, everyone regardless of vaccination status in school settings, in workplaces under Cal OSHA, in businesses or organizations requiring face coverings as a matter of local policy or business policy. Some businesses will continue to choose to require face covering indoors for everyone, including those who are vaccinated. For example, Marin County Board of Supervisors will require face coverings for all in-person participants, regardless of vaccination status, beginning at its first hybrid meeting next Tuesday, November 2nd. We should continue to respect those requirements by carrying and being prepared to wear face covering wherever we are while in public. The change in this mandate is a sign of how we in public health hope to approach the remainder of the pandemic response and recovery. using fewer mandates and laws and more offering recommendations and policy supports to remove barriers to making healthy choices. High vaccination rates and an understanding of the value of face covering have made it possible to begin to lift restrictions. We will continue to monitor COVID-19 in our community very closely and continue to adapt our strategies. Looking at our experience so far in managing the pandemic together in Marin County, I'm confident our community knows how to respond when we need to if the situation changes. For now, we're grateful we can take this small step as we inch back towards normalcy. Thank you again for doing your part.